Okay. Hello, everyone, and welcome to the first ever CGHI Masterclass. My name is Jelena Brankovic, and I am the Vice President of CGHI, which stands for Coalition for Global Health Innovation. Now, to give you a few information as to how this will be working. So CGHI Masterclass will be, so at the very beginning, I will give you a quick introduction of CGHI, the nonprofit organization that is behind this masterclass. I will give a quick introduction of our speaker, who will then proceed to share his presentation with us. We will also have an interactive session, so I would love to encourage all of you to maybe, if you have questions, throughout the presentation, ask it in the comments, and then we will, at the end of the presentation, address them if there is enough time. As I mentioned, my name is Jelena Brankovic. I am the Vice President of CGHI. And a little bit about our organization is that Coalition for Global Health Innovation is a global youth-led nonprofit that brings together a diverse community of young professionals, emerging leaders from across 6 different continents and many, many countries, many, many cultures, many, many backgrounds. Our mission is to empower our members to transform their ideas into actionable projects and help advance equity and inclusion in global health. A little bit about what we do. It is, we actually advocate for health equity and inclusion worldwide. We create a platform for young emerging leaders to connect, to collaborate, to network, to share their ideas and resources. So, you know, maybe to develop courses like this and help people that need help. So we host webinars such as this one. We publish articles, blogs, and do many, many different projects. Now, as I promised, I would not like to waste much more time. I would love to introduce our first speaker of this masterclass, who is Dr. Zacarías. Since he will be talking and sharing his story, I will just give you maybe a few sentences for those of you that did not have the chance to meet him yet. Dr. Zacarías is the founder and executive director of Multipod Mentoring. He has been a global health mentor and practitioner with over 50 years of global experience. Now, he has done many things, from leading HIV programs at PAHO to mentoring over 140 young professionals from around the world. So yeah, this is a little bit about Dr. Zacarías, and now I will pass the mic to him and let him tell us his story. Dr. Zacarías, the floor is yours.
Thank you very much. First, thank you to the coalition for letting me be the first speaker. I hope you don't find my life and my professional career very boring, okay? But I'm going to tell you because I think you can derive a few lessons from what I have gone through in 55 years of work and more than 80 years of life. So what I wanted to do is I'm using a presentation I made about 6 years ago at a meeting in Sweden of the Swedish International Health Society Network, I'm sorry. And they asked me to talk about my life. So the only thing I have done is update it and put a few of my observations. At the end, I would like for the young people to talk about their future. And I have chosen 4 big questions for you to try to address, at least one of them. So you are not going to ask me about my life because I'm going to tell you almost everything. Okay, let's start. And let me share my screen Just a moment. Give me one moment. Can you see my screen now?
Yes, perfect.
Oh, okay. I'm very visual, so I prefer that you look at the slides and looking at me, you're going to hear my voice and my Mexican accent. So I'm going to talk about my first century of life. Of course, I have not completed my first century, but I'm on my way. Okay, I don't know if I'm going to reach it, but my family lives very long. I have 4 of my aunts and my father who live after 100. So I hope I can reach the 100. These are the credits. I want to give credit to all the young people that have asked me for advice throughout all these many years. And as I mentioned often, I didn't know that I was a mentor until about 20, 30 years ago. Somebody told me, oh, Dr. Zacarías, you were my mentor. I didn't know that. But I felt very honored and very happy because of that. There are 46 countries represented here and people from all disciplines, mostly from the health area. Now, I would like to leave you with this thought. This is what happens to us, older people. Our memories are there, and that's why at age 50, I look back at my life, and again, at age 74, and the last time was now to update this presentation. And I'm going to start from the very, very beginning. I was born in the United Mexican States, a country surrounded by water, all sorts of seas and oceans, bordering on Belize and Guatemala to the south, and with the United States of America in the north. But my travel started long, long, long ago. My family, and you can see that in me, comes from Lebanon, from the Middle East, and also from Spain, and also from the Native Americans. About 15% of my genes are from Native Americans. And these are my genes. I did that a few years back on Ancestry DNA, Middle East, Iberia, Americas, Rome, which is Italy, the Caucasus, and then the Phoenicians went back to North Africa. But my story started as the stories of all of you in Mother Africa, which is the birth of the hominids that became the Homo sapiens. And then they went through the Arabic Peninsula into the Middle East, and then they went to the rest of the world. But as far as the Americas, they went east, and then they crossed the Bering Strait, and through Alaska, they came into the Americas. To my country, they came around 10 to 15,000 years ago. But my mother's family migrated in the 18th century to Mexico and established themselves in this area, which is called Aguascalientes and San Luis Potosí. And then my father's family were left Lebanon because of the Ottoman Empire and went first to the US, but they didn't like it. And then the ship continues to Mexico, to Veracruz, and then they disembarked there. And the ship continued to Sao Paulo, Brazil. And I also have family in Brazil, the United States, and Mexico. The travel has not ended. I married a Danish woman, and then we had two daughters. One of them married a young man whose family comes from England and Germany. And my second daughter married a young man whose father was born in Latvia and mother was born in Lithuania. And this is the United States of America. And now I don't know what's going to happen, but what I wanted to illustrate is that we are all a mix of all kinds of races, ethnicities. If you do a genetic analysis of yourself, you will find that you have many, many origins. I thought when I married my wife that I was getting a 100% Dane, and she lied to me. She had British Isles genes and some German genes, and I was disappointed. No, I'm sorry. No, that's a joke. Okay, this is where I work since 1969 when I became a physician. And it's basically the Americas. And North America, from Canada, United States and Mexico, Central America, the English, Spanish, French, and Dutch Caribbean, and then the Andean countries, all of this, and the Southern Cone, Chile, Argentina, and Uruguay. And the giant Brazil, where they speak Portuguese, and with them we speak Portuñol, a mix of both. So if you know English and Portuñol, you can, English and Portuñol and Spanish, you can communicate with everybody, So that's a big advantage. And this is what I did most of my life. First, I was an infectious disease specialist. Then I went into the field of venereology. That's what it was called. And then the venereal diseases were called sexually transmitted diseases, and now they are called sexually transmitted infections. What you see, the yellow spheres that you see here is HIV, that we used to call HTLV3. And the point I want to illustrate is that even before the virus was isolated, we knew how to prevent HIV/AIDS. We knew it was transmitted via sex, through blood, and from the mother to her unborn child. And this is what happened. These are the first years that I lived with the epidemic, with the pandemic. Young men presented with Kaposi sarcoma or with some sort of pneumonia. We saw the despair of people, and everybody died. I stopped sleeping at age 40 when I became the head of the program because it was too much. It was too much. You saw that all over the world, all over the world. And what we did, even before the HIV, that we knew that that was the virus, we started to help the countries build their national AIDS programs, even before they had the first case. In the Americas, that's what I mean. And then 2 years later, in '83, they were able to isolate the virus. And by 1985, we had a test. And we were able to start testing. It took us about 10 years to introduce the test in all the countries of the Americas, but they were already prepared because they had a program. And people were so interested that lots of money went to the World Health Organization, and we were all over the world, the World Health Organization. I was the head of the program in the Americas. And one of the most important parts, besides the science and the technology, was really the social mobilization. And it started with gay groups, and it started with groups of sex workers, and started with groups in society. And we had never seen anything like that. Nobody had social mobilization for tuberculosis or any other disease. But AIDS became such a political cause, and people started moving. At one point, at the beginning of the pandemic, in the United States, they have what they call the quilt. There are things that people weave and put on the floor. And here you can see people looking at everything with the names of people who have died. And we used to recite the names of people who have died that year. And it took us one full day, each one of us reciting 10, 15 names. And here's Freddie Mercury from Queen. You know, the band Queen, YMCA, and We Are the Champions, etc. And that's the way it looked. That's the way it looked. The 1st of December, that's what we had. And there was social mobilization all over the World Aids Day, then campaigns directed to men who had sex with men and Stop AIDS. Now, as you know, in Africa, in some countries, HIV/AIDS is still the #1 cause of death. And now they have interrupted the PEPFAR program, and the clinics don't have antiretrovirals. So that's a big problem. And there's now some sort of censorship of movement against what is being called, what the coalition and ourselves do all the time, the DEI, diversity, equity, and inclusion. And this is my life. I thought about 3 indices. This is totally subjective. One, I was always interested, not interested, I wanted to be useful professionally. That was my first idea. That's what I wanted to be. Happiness was something that, of course, one is interested, at least in the first 30, 40 years of your life. But I think that happiness is overrated. So don't worry if you are not too happy, because happiness lasts only a few days, a few months, a few years, etc. But usefulness will last as much, as long as you want. And the other one is the intensity of your life. So here is my usefulness. And I felt that I was useful 5, 10, 15, 20, 30 years. But I started before, 25 years. And the intensity of my life was tremendously high for 25 years. Running all over the Americas and the world, traveling, I don't know how many kilometers, etc., etc. But what I want to illustrate is what happened to my life. The first 3 years of your life, you don't know, you don't remember, usually, what happened to you. But the first thing I remember is when I acquired the power to read and write. And that opened the world for me. Please, 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 never, never, ever forget to keep reading. The other big thing in my life is when I was 8 years old, my mother gave me a book on the life of Albert Schweitzer, who was a physician, a sort of a priest, a musician, and went to the Congo. He was French, but from the Alsace region of France. So he was also a German speaker. I went to Africa and worked at the lepers.
Very interesting.
Pardon? Oh, I don't know.
I would just like to remind everyone to keep their mics off because we had some background noise. Thank you.
Okay. A leper colony, and he worked there for many, many years. And then my mother gave me what I would say was my mission. What was I going to do with my life? And that was very easy because I knew what I was going to do. And then, of course, I was a good student, and I lived through the 50s, which were wonderful years, but even better, the 60s. The 60s with liberation with all the student movements all over the world, with the repression, with everything. And I was a judoka, a dancer in a folk group of Tapki, the Lebanese. I was a composer that I got married when I was in Denmark, and I got my MD degree. And then I went to the United States with my family and did my internship and residency and fellowship. And I ended up being an infectious disease specialist. That was my profession. It took me a long time, but it's the normal time. But I still wanted to work at the Pan American Sanitary Bureau, which is now called PAHO, the Pan American Health Organization. After my training, I went back to Mexico. And as many of you physicians, you have to have 2, 3, 4 jobs. So I was a clinician, I was a consultant to other doctors in hospitals. I did research in public health, and I taught parasitology and what we call then family medicine and community health. Then the government changed, and in my department, we were 109, and only 9 of us were left for the following 2 years. And it was really, 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 really tough. I won't give you any details, but finally I decided to go back to the US and get my MPH degree. And I got my MPH and my doctorate here. And then I went to the Centers for Disease Control and Prevention in Atlanta, and then to the Pan American Health Organization, where I headed the AIDS program. When I counted a few of the years, I had traveled during that time 2.5 million kilometers to 50 countries, not only the 42 of the countries and territories of the Americas, of the 48, but also Spain, Switzerland, many, many other places. That was the Americas. And I want you to see what I mentioned before. When my life was most intense, and when I was feeling very useful, and was being useful, because we evaluated the programs every year. That was my area in which I was least satisfied. And I want to tell you this. This may happen to you. I was so enamored of my career, of how important I was and the work I was doing. One day, one of the ministers, they come to Washington once a year, and one of the ministers told me, Dr. Zacarías, why don't you come to my country, and we're going to make a tour, and we go to Cochabamba, we go to Santa Cruz, and Bogota, I'm sorry, La Paz, etc. And I said, oh, okay, I'm going to go. Yes, of course, I'll be there. And I went there, and my wife told me, don't go. But I was the big shot, so I went. And when I came back, I felt like a hero. And my wife was like this. When I wanted to tell her how good the trip had been, she said, yeah, you had a great time and you did lots of things, but the Minister of Health maybe goes out in 1 week, in 1 month, in 1 year. And our daughter will never graduate from high school again. And you weren't here. Wham! And this happens very often, especially to us men, because women really know what's important in life. We don't. We have our job. So at age 51, everything I have done before was lost. I lost the AIDS program. It doesn't mean I lost everything, but we were 29 and only 2 of us were left. And boom, I went down. I continue to work with a broken heart. And you will have to do that sometime in your life, and you have to be resilient. And I did that until, all the people I have helped, and I put that quote unquote, betrayed me. the directors of the national AIDS programs no longer needed me or my program because the money was now coming, the resources were coming from UNAIDS, the United Nations program. And we had to rebuild the program starting in the Caribbean. And we had the help of the Germans, the Dutch, and the French, and the British mostly. Then at PAHO, at that time, you had to retire at 60 years. And sometimes this happens. You get lots of illnesses. Your body has been, running on adrenaline all the time. And here's why I started illnesses. The only thing I had okay with me was my heart. Okay, otherwise everything else was in bad shape. Then when I felt so depressed, PAHO called me back. And they said, oh, Dr. Zacarías, it's only 2 weeks, and what we want you is to see how we can manage this program, etc., because we're having problems. I stayed for 2 years in that program as acting chief of health analysis and statistics. Don't think that I know statistics. I know health analysis, but not statistics. But I had geographers, statisticians, epidemiologists, etc., so we did very well. But I had to do things that I never thought I was going to be able to do or wanted to do. But you had to fire people that are good. And it's for the good of the rest of the program. I still feel bad about that. And then I work as a policy advisor in the organization in the area of family and community health. And then I help develop the regional strategic plan for until 2021. Okay, but I stopped working here. And then 2008-9, we lost our investments because of the market crash. We had some savings and we didn't lose everything. But that was a big hit on our lives. And later on, with a group of friends, we founded what is called the Global Health International Advisors, a think tank based in Washington. And I was there from 68 to 72 years. And here's where I started mentoring formally. So, I'm a mentor. And you will see that and then I had 3 operations in 8 weeks. One of them was an emergency operation, and the third one was a scheduled operation. And I had a cardiac arrest. Fortunately, I was in the best place where you can have a cardiac arrest. Well, fibrillation and fibrillation. And I came back. I was okay. But that was something that really made me think, because I didn't even know. I woke up 2 days later in the intensive care unit, and they had told my wife and my daughters that they didn't know what was going to happen to me, because they didn't know how long I was unconscious or without heartbeat. But this is not the first time I faced death. I faced violent death when I was 17. And I put that in parentheses because obviously I survived. And again, when I was 54, also violent death, but I survived. And the reason I'm giving you these examples that sound gory, etc., is because I want you to reflect on your lives. If I had died at 17, what would I have accomplished? I mean, I was given my mission. I could read and write, and I had started to being a good student. But I would have died at 17 when I just entered university. And most of this I wouldn't have had. What if I had died at 54? See where I was. I wouldn't welcome death, because even if I was really depressed, I didn't want to live life. I really like life. And I survived. And then here, I would have had a good, good and bad life. And then when I was going up, I would have died. And the point is, I wouldn't have founded my own program, Multiple Mentor. So this is my life. Now I'm more than 80, and my next step, my next project, is to develop this multi-country, interdisciplinary, and transgenerational intelligence network, and something that I always wanted to do. So this is my life. This is a summary of my life. And then I thought, oh, let me see what has going on in my life. And this is the quality of years. Again, subjective. And you can see the good years, the very good years, blue, in yellow, the good years, the okay years, where you are like a zombie, with all the medications, etc. I don't know, the next 20 years. And then I had six very bad years where you sleep in your closet because the darkness is not enough in your bedroom. But when I made a summary, look at this. 70% of my life has been good and very good. And only 24% of my life has been bad and very bad. And this is the 2 years that I don't like because I didn't know what was happening. I lived, but I don't know what happened. Now I'm 80, and I'm on my way to 100. And my question to you is, this is my road, my way. What will be yours? What will be yours? And this is what we do in the program. 3 questions to determine your pathway. That's the P of multipod. Who am I? What am I? What is my ikigai? My mission, my vocation, my profession, and my passion. The intersection of all of those. And then you want opportunities. How do I know what I want? Especially your generation, it's very difficult. How do I find and how do I get what I want? And how do you make your decisions? How do I choose? When? And how do I know this is it? All my life, I wanted to join the Pan American Health Organization. And for the first 2 years, I was really unhappy. It was a disappointment. It was not what I expected. And then I loved it because it became my passion, what I did. This is what I have learned and what I would like to share with you. I shared previously with some of you. You travel, be profoundly human. Kindness is a talent. Evil is skill. You have to practice evil to become very good at that. And kindness is great. Pope Francis, who just died yesterday, and may he rest in peace. It's a good man. I advise you to move in that spectrum. Don't try to be Mother Teresa, and don't be a bad guy, Idi Amin, or whatever. You are 3 people. Who you think you are, who others think you are, and who you really are. I want you to try to get all of them together and become friends, because you can live with only one of them all your life. Maybe your father, your parents wanted you to be a physician. My father wanted for me to be an economist, and I didn't want to be an economist. That's what he wanted. That's what he saw in me. I wanted to be a doctor. Find your purpose in life, what we mentioned before. Keep in mind that what you do is what you are. You are a carpenter because you do carpentry. You are a physician because you do medicine. But what you give is who you really are, what you give to others. People talk about the present. When I was growing up in the 60s, oh, I always say, live in the now and here. And everybody was, the present doesn't last that long. So don't worry too much about your present. Because your present, you can define it as 1 minute, 1 second, 1 year, 2 years, 5 years. Go to your past, what you have accumulated, and jump to the future. Don't believe in luck. I don't want you to hear, oh, I was so lucky that I was admitted to university so-and-so. No. Believe in possibility, probability, opportunity, and risk, and your action. And then you will be lucky. Of course, there are lotteries and other things that also depend on probability, but don't worry about that. And maybe you already know this. I think you do. To solve problems, you not only need what you know and your intelligence, but you need creativity and your imagination. And people say, oh, I was thinking outside the box. No, also try to build a new and open box where ideas come and go and flow and are accepted or rejected and go in and out, because that's what will make progress. It's not the same thing to ask questions and to learn to ask. It takes time. And questions, I will tell you, are more important than answers. Pay attention and listen. Very tough, especially for me, because I like to talk. Manage your power and learn to persuade. That's something that we need to do as professionals, because we use logic and we believe that the politician is going to follow and do everything because we are giving him or her the facts. Many decisions rely on feelings, the sense of justice, the benefits for the decision maker. You are an impresario, okay, you want to make money, well, this will give you money or prestige or whatever. But another one is hope. Again, possibility, probability, and faith. What if? What if? What now? How now? Why now? And you need to be tough. And your skin will be thicker. And you'll be ready for the next time. And this, no excuses, please. No excuses. Be successful, my friends. Be successful. And now this is what I ask you to do. Stay the course. One of our directors 4 years ago said, when somebody complained, no, I'm traveling all the time, blah, blah, blah. If it were easy, you wouldn't be here. It's not easy, but that's why we are here. Young men, I have cried so many times. Don't worry. You'll still be a hero. Young women. I'm sorry, let me see. You know how resilient you are. Now be invincible. Accept the fact that you are already Wonder Woman. I keep telling the young women, you are going to live 3 lives. We men will live only one. You live 3 lives simultaneously, and that's why it's admirable that you can do that. We couldn't. Make your life count, that's your obligation. And live your life not only for you, that's your debt to the rest of the world. Live your life not only for you. And then don't forget, fight for life, justice, and freedom until the end of your strength and time. What I hate the most is slavery. And you know that there are millions of slaves. Nowadays, at the current time, in many countries, there are slaves, women who are forced into sexual trade, children who are brought to work for free as slaves in houses in some islands in the Caribbean. But the most important, not the most important, but thing that you should not be concerned is if your name disappears. That is the fate. Who remembers or who knows the names of the grandparents of your grandparents? And I'm going to give you some homework. You describe who you are now and with conviction what you will be soon, later, and finally. And what you do now and what you will do soon, later, finally. When you can look back at your life and see what you have accomplished. And you will feel proud and content and satisfied, because I don't want you to look back and say, oh, I would like to have lived a different life. This is your opportunity, my friends. I'm not tired to tell you this. You are indispensable. Indispensable. Again, if somebody tells you that you are indispensable, that you are not indispensable, the answer is shut up. Why are you indispensable? Because your life won't happen without you. And your life is so valuable because of the field that you have chosen and the life that you have chosen. It's really valuable. And you are part of a workforce. And you will need to use your thought. We are intellectual workers. Your action, your energy, and your talent. And then you have to think, what else? Because I'm going to give you now 4 challenges. Because you are not going to ask me about my life, I hope. And I don't know anything about HIV/AIDS because I haven't worked in that area for more than 20 years. But these are some of your challenges. The climate change, all the pollution, the starvation, the hunger in different parts of the world. This is COVID. This is polio that may return if people abandon vaccination. This is AIDS that is going to return in Africa at least, and some places in Asia. Poverty, the forest fires, and war. And many other things that you can think of. So I have 4 questions for us to reflect and to hear your thoughts. The first one is, this is the classical. How to complete, this is also from another director at PAHO, what we call the unfinished agenda. How come in many countries we still have neglected diseases that are still being neglected? Parasitosis that could be resolved and cured and eliminated very easily. How to address the current problems, and you know the current problems. Climate change is one that everybody identified as one big one, but you need also to prepare for the future. As I mentioned in many occasions, the century is yours, and the planet is your responsibility. We are on our way out, the previous generations. We did what we could and what we did. But now is your turn. This is a theme that one of our mentors keeps insisting, and he's right. How to coexist with this revolution of artificial intelligence and not let it become inhumane, because it's going to be another species, another family after Homo sapiens. And what would we do? How can we make it work with us and for us? And this is one of the causes of the problem. We see just the consequences. And we talk about social determinants. but go to individuals. How do you respond to ignorance, ineptitude, indifference, the sensation of powerlessness, of weakness, stigmatization, tyranny? And lastly, is it possible to fight fear, greed, hate, selfishness, cruelty, violence, and evil? And for this discussion on these matters, if you want to talk about this, or any crime, or any good action, there's always a motivation. You need a means to do good and do bad, and you need the opportunity. So many times, if you cannot fight this, because these are motives, greed, hate, selfishness, etc., you have to work on how to deprive that people from the means and the opportunity. And in the opposite case, good deeds, the motive is selflessness, kindness, etc. You have to provide the means and the opportunity. But how are we going to do that? I would like to end here, but perhaps I should, we can come back to this at the end. But remember, your main purpose is to build a healthier, safer, healthier, fairer, and safer planet. That's your responsibility. That's what we're going to do. And I think that's all I have to tell you. It took me more minutes than what I wanted, because I wanted to have more time for your questions to yourselves and to us and to everybody, and your reflections on that, especially on some of the issues that I listed here. Starting in July, I'm not going to be mentoring individually, but I'm trying to build this last group of several generations, disciplines, and countries to think and find approximations to solutions or solutions. This and many other areas, and choose one theme, one subject, and work on that together. So I leave you there, and thank you, Yelena, and all of you. And please, let's start the conversation, not a monologue.
Thank you, Dr. Zacarías. Thank you for your presentation. I think all of us could listen to you for days when you speak. But now that you have asked us some questions, and I think that I would love to invite, because we have so many attendees here, 28 if you count you and me. I would love to open the floor. If anyone would maybe love to respond to some of Dr. Zacarías's questions, or maybe share their thoughts, or even if they have some questions for thinking of their own, feel free to raise your hands, and then I will ask my CGHI team to monitor the chat, and maybe whoever wants to speak, so that we would be able to let one by one guests speak. Do we have maybe anyone who would like to reply to these questions, or maybe share something they were inspired to think about throughout the presentation?
One of the things that I want to tell you is the number one fear of everybody is to speak in public.
Yes, so, I believe we have one hand, one volunteer.
Oh, we have one brave soul. Perfect.
Christos, feel free to unmute and share your thoughts with us.
Well, thank you very much. Well, I have to thank Dr. Zacarías and the community for being able, on one side, to tackle this fear, although I don't think that I had a lot of fear of speaking in public, but this is also a disadvantage in the sense that if you do not know what you speak about, then you come out as a fool. So I was very happy to be part of the multi-pod mentoring program for before 5 years actually. It was 2020 in the beginning of COVID, and it was such a period that I was able to learn a lot and see probably a different aspect of health and care rather than the one that I was being taught in medical school at that point. If I would have to take one of these questions, I would probably go with the second because it's a question that I face in my everyday life as well. Artificial intelligence and certainly a lot of large language models that are everywhere in our cell phones, like ChatGPT, Gemini, and so on. It's actually quite difficult in the sense that on one side, the volume of the work that we have to do, especially those of us that work in the clinic and have to combine research with this, essentially motivate us to use it in order to be able to learn more skills, for instance, how to do a statistical analysis or how you can break a method that you have not previously used in small steps. It also helps with clinical learning. For instance, instead of searching in a book, I have had the chance to, let's say, ask, okay, which artery is under this muscle, and I got a response without taking 20 minutes to find this. So I think that it's something that teaches us our vulnerability or our limits. All of us, or most of us, that we are all highly educated people. We tend to think that we know everything or we have the means of knowing everything. Probably we do, but we do have limited capacity, limited resources, limited time, and also a sentimental, let's say, world that can compromise our ability to think and act. So I think that the existence of generative AI can teach us humility, cultural humility, which we need towards one another, and which we can certainly use when interacting with machines as well. That would be my 2 cents in this. Thank you for the time, and happy to receive more response or feedback.
Amazing. Thank you, Christos, for sharing this. Dizzy, if you do not have a response, we have one more hand. Katerina, maybe she would like to share something with us.
Hello, can everyone hear me?
Yes.
Thank you very much. So firstly, Doctor, thank you so much for your time, for your insight, for sharing your life story, and as well as your knowledge and wisdom from your life story. Really appreciated it. Something that really stood out to me was throughout this entire masterclass was the power of reflection, the power of, and also something that you really kind of shocked my mindset was the power of not being in the present, to allow yourself to jump from the future to the past and to be in the present as well with that. Because so many times I've heard you must be in the present, you must commit to the present too. So to hear someone to say, no, if you're allowed to go in between the present, the future, and the past, and with that, the power of reflection to actually create that aim and motivation and what's the next step. I thought that was a very cool lesson that I'll definitely be taking away from this masterclass. And a possible response to one of these questions for reflection, is the third point, how to respond to ignorance, ineptitude, indifference, powerlessness, negativism, and tyranny. I think actually something that, so my name is Katerina. I'm based in Cape Town. I'm currently a tutor at the University of Cape Town, tutoring in anthropology, and I am so a student at the UCT at the Design Thinking School, partnered with UCT. And something that we're doing is we're consulting a community center that wants to be built in really tailor that community center before they even have the blueprints towards the needs of the community. And I noticed, I'm in a team, and something that we were actually having a little bit of a frustrating day the other day, and we were trying to work with feedback that we had been given and find ourselves on the same page. And it was close to the end of the day. We still hadn't settled on an idea. And I was feeling extremely frustrated. And I think that frustration was being shared with the table. But in that moment, something that I remembered actually from your previous visit with CGHI was kindness. And I thought, how can we show kindness in this moment of frustration? And I realized that something that we were all grappling with was what our expectations were for this project, what we really wanted this project to look like. But that meant that we weren't really working with the feedback. We were really in love with the idea of what we wanted it to look like. And so in that moment, when we all had different ideas, we were feeling very powerless. And so the frustration was building. So something that I did in that moment was communicate that I was feeling frustrated, and that it wasn't actually frustration at each other. It's that we were, what I voiced was that we all actually care so much and we just want to find the best path. So how about we just lay out all of our ideas, all of the emotions we're having, and let's see if we can find a way that we can balance what we would like for this community, whilst also working directly with what this community has voiced to us. And we ended up finally ending the day with an idea that we actually had at the beginning of the day. And it was just so funny because for me, it was the moment of remembering to be kind in the moment. And also something that I find tends to be a blocker with ignorance and with indifference and with powerlessness is our expectations of what we want something to look like, rather than working with what we actually have. So yeah, those were my that was my note, and I just wanted to say again, thank you so much for your time, for your insights, for your input, and I look forward to hopefully seeing you again.
Thank you, Katerina, for sharing this. I will ask Dr. Zacarías if he has something to reply to this, or shall we ask the next speaker to share their thoughts?
Please continue, and
okay.
Everybody, I mean, they have better answers than I.
Okay, perfect. Nicole, and then Adrianus.
Yeah, hi. So Dr. Zacarías, first of all, thank you so much for being so open about your life story and sharing with us, and always being inspiring and asking us these questions for reflection. I think that's an incredible and important practice to do, you know, when you take time to reflect, and we can really look at our path and where we're going and calibrate the compass. So I wanted to respond. I have a question, but I also wanted to respond to one of your questions. So the last one, is it possible to fight fear and greed and hate and all these negative things in the world? I consider myself an optimist. And so to that, I respond yes. But the question is how? Of course, I think we can all agree to yes. I believe that everyone can be a leader. It doesn't matter what your position is, what your title is. Everyone can embody those qualities. And I really believe in the subtle influence of servant leadership. And so I think we have to start on a personal level in order to combat these things that we see in the world that can be so overwhelming, but not allow ourselves to be paralyzed with the fear or be so overwhelmed that we just don't know what there is to do because there's so much to focus on. I think if we direct our focus inward and we think, okay, in the morning, what can, like today, how can I embody these characteristics? How can I be a good human? How can I, you know, really honor the humanity in everyone that I interact with today, and you know, live up to my highest purpose. So I think that starts on a personal level, and then it also extends to family and our community and our circles. And I really believe in the power of that, almost like the butterfly effect. And so you don't know how many people you're going to inspire just by being who you are and staying true to what your North Compass is. So that you know, to me, I guess if we just start with ourselves and have integrity and be kind and choose to be good people, right? That's how I think it's possible not to get overwhelmed by all of these things that we see happening in the world, and that's on a personal level, but also, of course, it can apply to our professional work. And that leads me to my next question, which is, since you first introduced it, I think in one of our previous calls, the concept of merging and having integrity with the three people that we are. So the person that like we know ourselves to be, or like the person I know, I think I am, the person other people think I am, and then what the real actual truth is, like who I really am. And the second part catches me, and I wanted to ask how do you manage other people's expectations of yourself? Basically, like that's how I understand it. And you know, what if like you feel as if people misunderstand you or people judge you and don't listen? How do you respond to that in order to have this integrity of whole in your being and how you operate in life? So thank you.
Thank you, Nicole, for sharing this. Again, Dr. Zacarías, do you want to reply to Nicole's last thoughts, or shall we go on?
Keep going, please, because this
Okay.
is so wonderful.
Okay, I thought, Adrianis, if I am pronouncing your name correctly.
That's correct, Adrianis, is correct. No, I'm actually amazed by the courage that Fernando has in displaying his life in such detail, with graphs and peaks and troughs to us all. I was totally amazed to see this huge trough just around his retirement between 55 and 65. And then most amazingly to get out of it and develop such important organization and initiative that helps other people. That's only wanted to share. I don't want anything to add, but I was extremely impressed with this presentation. And thank you, and kudos to you, Fernando.
Thank you. Thank you so much.
Thank you so much for sharing this. I see we have one more raised hand, that is Shakeen. Shakeen, feel free to unmute yourself.
Thank you, Irena, and thank you, Dr. Professor Zacarías. I'm Shakeen, and right now I live in Argentina, and thank you so much for this presentation. And I find very insightful. And there were two concepts you mentioned really stayed with my mind, and I have more curious about them. The first is about also what Catalina mentioned earlier about we go back to the past and jump to the future, not stay in the present so much because it doesn't last for long. And this is so different than what we normally hear. And I would like to hear if you could expand a little bit more about this. And also another thing is earlier you mentioned to think outside the box, to think not to only think outside of the box. And I remember normally we heard about, okay, creative thinking is about to think outside of the box. So I would like to ask Dr. Zacarías about what is this, what is the box exactly means to you, and what exactly, for example, when I think about the box, maybe it's the societal norms, or our limbic system connect, like how to react, or our mental habits. So I would like to hear more about what do you think about it? Thank you.
Thank you for sharing this, Shakeen. Do we have any other comments? I do not see any raised hands, so maybe, Lizzie, would you like to give us any thoughts after this round of discussion?
Yeah, well, I don't know the answers. But, you know, I will start with the last question. It's not necessarily a box. What I'm talking about is space and time, and is to develop ideas, use your creativity, your imagination, because not everything has been discovered or uncovered. I remember one of my friends in Brazil that told me one day, Zacarías, why don't you talk to Sofia, one of his little daughters, because she was crying because everything, she said, everything has been discovered. But I wanted to be a scientist, but we know everything that there's to know. And there's so much to explore. You can go into philosophy, you can go into technology, you can go into any of the science of the humanities. And there are so many things to still explore. So you can think outside the box, but my idea is not only to leave what is already dogma or orthodoxy, etc., but also to think about other ways of approaching a problem, or better yet, an issue, which may not be a problem. So, for example, in artificial intelligence, are we going to be able at some point to compete or become the chimpanzees or the Neanderthals in front of an intelligence that is so superior, so fast to our own intelligence? What happens when the machines start communicating between and among themselves? What happens when they develop empathy or something that resembles empathy? I mean, how can we, again, coexist? What kind of box can humankind develop to deal with that? And many of the great discoveries have been by serendipity, but some of them have been by people thinking and thinking and thinking. And what I think is that every problem has at least one solution. And the real challenge is to find out what the solution could be. And then when I talk about all these points, ignorance, okay, as Katrina said, education, to what level can you do that? Ineptitude, can you train everybody? Indifference, how to, and again, Nicole talks about leadership. And the world is not divided into leaders and followers. There are leaders, followers, and people who advise the leaders. Professionals who know, professionals or wise people that know what's important and can give advice to the leader. But I agree that all of us should be leaders, but leaders of our own life. That's the most important point. That you don't do what other people force you to do. And that's why I'm so much against tyranny and slavery. Nobody has the right to do that. Then how do you fight fear, greed, hate, selfishness, cruelty, violence, and evil? Those are motivations. Those are motives. Are you going to put everybody in jail? Are you going to kill everybody? How can we live with people who have those, I won't call qualities, but characteristics that are moved by that? There was another, I really don't think that you have questions, but you have really ideas to reflect. And I don't think I can give you any answers at this point. But I know that you are going to find your own answers. And knowing where you are at this point in your life, I know that you are going to find at least of many of these things, because we have no idea of what is going to happen in the future. What comes after artificial intelligence? Are we going to become obsolete as a species? I leave you with questions more than answers. And that's what I want. Again, and the other point I want to tell you, I started with a list of the people that I have had the honor and the privilege of working with in their own lives, because they trusted me. And what I want to tell you is that if you can find somebody who can help you with the direction of your life or to help you with the decisions, please try to find a mentor, somebody you admire, somebody who you can trust. And don't be shy, and don't think that you are not giving something in return. You validate the life and the profession of your mentor. You give her or him energy, stimulation. You bring knowledge, you bring skills that an older mentor can never acquire, because it is too late to catch up. And remember that you are the first generation, or the second generation, or the third generation that lives with the computers and with the cell phones and whatever. And also remember that you have a big challenge. This is the first time in humankind history that 4 generations are going to live together on Earth. Before, you had your grandparents, your parents, and yourself. But now you will have your children, and everybody will be living at the same time. And everybody will have a different perspective, different experience. One thing that gives me great hope is when we ask people who apply to the program about their values, you know that they're the same. No matter where you are in the world, no matter your social class, your ethnicity, your race, your religion, we all share the same principles. And one of the things that really impressed me, that honesty is the first one. Everybody talks about honesty as the thing they most admire. So I don't know if I have given you more things for reflection, more ideas for reflection. For your life is yours. And again, the 3 people. How can you convince somebody to think you are bad? How can you contrarrest violence and evil and greed and hate and selfishness? I know what to do, or we know how to do, at least theoretically, with number 3. But what do we do with number 4? So I would like to invite you to be part of the program, those of you who are still interested. This year we wanted to have a smaller class, and we have too many mentors that wanted to mentor, and new mentors that are joining the program. So even if we had already started with 1 cohort, we could start the 2nd cohort in June or whatever. And it's only 7 sessions that you need to be successful. But I don't guarantee that, but that you have a good chance of being successful. Okay, Janeda, thank you so much, and thank you so much to everybody for listening to me for such a long time.
Thank you, Dr. Zacarías, for sharing again everything with us. I think all of us are left with some food for our thoughts, something to think about, something to reflect. As we are obviously nearing the end of this session, I would like to thank everyone who dedicated some time to join us today for this session, for this masterclass. We are planning another one soon from also a familiar face from Multipod Mentoring Program. I have also shared the links both to Multipod and CGHI in the chat before, so you can find all the information on our websites. Again, thank you for joining us. It was my honor to host this session, and yes, for the very last point, I see that it was also raised, so screenshot for of the participants. So I would ask Dizzy if you can turn off your presentation so that we can take a quick screenshot, and maybe some of us can, whoever is able to just turn on their cameras, and we can take a quick screenshot of all the attendees here. And please, I would also like to invite my CGHI team to take multiple screenshots so that we can forward them later on. Is everyone ready? In 1, 2, 3. Okay, perfect. Well, with that picture being taken, I would once again love to thank all of you. It was very nice to see all of your faces and hear your thoughts. If you want to get in touch, please find us on our websites. All the information are listed there. And with that being said, have a nice rest of the day, everyone. Thank you.
So much.
Thank you so much.
Thank you. Bye.
Thank you. Bye.
Thank you. Bye.